Today, we're cracking open the blueprints that keep people safe during medical research. You know, it's a really complex world, but it's one that's built on a simple, powerful promise: to protect the volunteers who make all of this science possible. So, let's dive right in. I mean, have you ever really thought about it? A new medicine or vaccine comes out, and we're told it's safe and effective. But how do we actually know that? What's happening behind the scenes to make sure the people volunteering for these studies are protected?
Well, I can tell you it's definitely not magic, and it's not guesswork either. It's one of the most rigorous, most detailed planning processes in all of science. Every single step is carefully designed to protect the rights, the safety, and the well-being of every participant. And it all starts on solid ground.
Yeah, just like any strong building, a clinical trial has to be built on a solid foundation. And in this case, that foundation is a set of core ethical principles that guide every single decision from start to finish.
You know, pretty much every clinical study in the world is guided by three huge principles. They were famously laid out in the United States in what's called the Belmont Report, which was a direct response to some really terrible research abuses in the past. These three ideas, respect for persons, beneficence, and justice, they aren't just suggestions. They are the absolute, unbreakable rules of ethical research.
So let's zoom in on one of those: beneficence. This is really the heart of it all. It's this constant balancing act. Of course, the goal is to do good, right? To find new treatments and cures. But, and this is a big but, that goal can never come at the expense of a participant's safety. It means researchers have an absolute duty to maximize the potential good while doing everything humanly possible to minimize any potential harm.
Okay, so with that ethical foundation firmly in place, it's time to actually draw up the blueprints. And we're not talking about loose guidelines here. We're talking about incredibly detailed documents that map out the entire study, every single step. So, the first key document is the protocol. The best way to think of this is as the master rulebook for the entire study. It describes everything: what the study is trying to achieve, who can be in it, exactly what procedures will be followed, even how they're going to analyze the data at the end. It's all about making sure every single person on the research team is on the exact same page, doing the exact same thing.
And then we have the investigator's brochure, or just IB for short. Now, if the protocol is the rulebook for the study, the IB is the official safety manual for the product being tested. You know, whether that's a new drug, a vaccine, or some kind of medical device.
And the amount of detail that goes into this thing is just incredible. I mean, the IND has to have every single piece of information known about that product: what it's made of, results from lab tests and animal studies, any data from previous human trials, and a full transparent list of all the known risks. It even has clear instructions on how to handle it safely. It's basically the complete safety profile that investigators need to protect participants. Okay, so you've got your ethical foundation, you've got your detailed blueprints, but you can't start building yet. Before a single person can be enrolled in the study, those plans have to go through a super rigorous, totally independent inspection.
And this inspection? It's done by a special group called an Institutional Review Board, or an Independent Ethics Committee. You'll hear them called an IRB or an IEC. This committee is made up of a mix of people, scientific and non-scientific members, and they have one job and one job only: to be the guardians of the participants. Their entire purpose is to safeguard their rights, their safety, and their well-being.
And let me be clear, their approval is not optional. As the international guidelines say, a study cannot and should not begin without it. This isn't just a friendly recommendation, it's a mandatory, non-negotiable step. The Ethics Committee has to review and approve everything: the protocol, the investigator's brochure, every piece of paper that will be given to a potential participant.
All of this intense planning and oversight, it all leads up to what is arguably the single most important part of this whole process: informed consent. This is really where that principle of respect for persons comes to life. It is so easy to think of informed consent as just signing a form, you know? But that's not what it is. Not at all. It's not a one-time thing. It's an active, ongoing conversation between the research team and the participant. It's a process that makes sure each person truly understands what they're volunteering for.
And during this conversation, participants get clear, easy-to-understand information about every part of the study. They learn why the study is being done and what they'll actually have to do. Crucially, they're told about any possible risks and any potential benefits, and they are reminded very clearly and more than once that taking part is 100% voluntary. They can leave the study at any time, for any reason or no reason at all, without any penalty, period.
Now, the system is also smart enough to recognize that some people might be in a situation where they're more susceptible to pressure or influence. For these folks, who are called vulnerable participants, the ethical safeguards are even stronger.
So what does that actually mean? Well, the official definition talks about people whose decision to volunteer might be influenced by their circumstances. Maybe they feel pressure from a professor or a boss or a commanding officer. This could be students, employees, members of the military, or even people in detention. For these groups, there are extra steps to make absolutely sure their decision to participate is truly free and not coerced in any way.
Okay, so let's put all these pieces together. This brings us to how the principles, the plans, and the oversight all combine to make sure every single participant is treated with fairness and with respect. A perfect example of this in action is compensation. So it's totally ethical to provide fair compensation, right? To reimburse people for their time, their travel, the inconvenience, but that payment can never cross the line into what's called undue influence. The amount can't be so high that it pressures someone, especially someone in a tough financial spot, into participating when they otherwise wouldn't. It's a really fine line, and it's something ethics committees look at very, very closely.
You know, this whole system of review and approval, it's about so much more than just bureaucracy and ticking boxes. It's what ensures that the research is both scientifically solid and ethically valid. It's what makes the results trustworthy in the end.
Ultimately, every document, every committee meeting, every conversation, it's all part of a system designed to build and maintain public trust. It's a promise, really, a promise made to every volunteer that their safety and their rights are and always will be the #1 priority. And that kind of leaves us with one last thing to think about. The world of research is changing so fast. We've got new technologies like AI and decentralized trials where people can participate from their own homes. So, as we look to the future, the really big question is, what's the next great ethical challenge that we need to get ready for?